Welcome to this webinar from TextLocal on how to use SMS to communicate with your patients. First of all, I would like you to picture the scene. Derek is 78 and quite happily enjoying time visiting his relatives, whilst in a very busy and rather stressed hospital, there is a radiologist, two technologists, and some very expensive equipment that is going underused, all because Derek failed to confirm whether he was attending his appointment or not. Now, what does that mean? Well, the reality is that had he received an SMS from that hospital, for the sake of around 5 or 10 pence, we could have saved that wasted expenditure and given that appointment to somebody who probably needed it, and it could even be a matter of life and death. What's the true cost in money? It could be between £500 and £2,000, and that is the scale that you are looking at in terms of return on investment when you use SMS to communicate with your patients and make sure that they arrive at their appointments on times. So who are TextLocal? We are an industry leader. We've been around since 2005. And what makes us different is the features on our platform allow you to do far more than you would think possible with SMS. It's not just doing the appointment reminders that's important, but it's also vital that you understand how effective your campaigns are to make sure people turn up on time, and our tracking tools allow you to measure that effectiveness. Now, what I think we should do now is let's take a look at what makes SMS powerful. Mobile phones have become, as we all know, one of the most effective ways of engaging with consumers. If you think that up to the end of last year that there were more mobile phones in operation than there are people, then you become to realize that we are a nation who work on multiple devices. Some of those devices we will use temporarily, others we will have them by our sides. Some people will have their mobile with them for more than 16 hours a day. It's the first thing they see when they wake up, the last thing they touch before they go to sleep. And it's this dedication to their device that makes the SMS so powerful in having that instant interaction with somebody for them to be able to receive your appointment reminder and to be able to act on it. So let's have a look then at what this means for the health sector. Some people may say that it's more prevalent for younger people to use a device. However, the reality is quite different. If you look at the number of over 75s with a smartphone, I'm sure you'd be quite surprised. And in fact, over 71% of the total population uses a smartphone. And it's use of a smartphone that allows you to do far more in that interaction around two-way messaging, around the types of systems that they can take access to, but we'll cover that in a little bit more detail. As people become more used to shopping online, they start to view SMS as a trusted channel of communication. You only have to look at online retailers, logistics providers. They're all using SMS to capture your attention. But what's quite important is that when we look at the average cost of a missed appointment in the NHS, and that's around £160, you get to realise that for a few pennies, you can make a very easy return on your investment, but also free up those appointments to give them to somebody who'll be more in need. And it's thinking about that brings us onto the next page, where what we will do is look at the specific uses for SMS in health. Originally, people would send out an appointment reminder, and in fact they still do. They'll broadcast a message and then hope that that message has got through, and then hope that those people will then turn up. But in this day and age, why should we just use a message and broadcast? Why should we not ask the patient or the service user whether they will be attending? If they can attend, that's great. If they can't attend, what are we going to do about it? And what are we going to do to remain in control of that change? With the TextLocal SMS solution, you will see on the next slide some mock-up images of how people can text in a response. Now, if you consider how email works and how you can set up rules for emails coming in and going to certain mailboxes, you can do the same with SMS. And in this way, an email can come into an inbox, and if it's yes, they are coming, that can update the EPR or the PAS system, whichever you may be using. If it's a no, then you can trigger a different set of events. Those events may be to offer them an online calendar where they can maybe go and rebook their appointment. Alternatively, it is a flag to the person dealing with appointments to pick up the telephone, to phone that mobile device, engage with the service user and find a new date, cancelling that one and freeing up that space for somebody who needs it. Absolutely vital that you use the communication devices available to you in such a way that you focus your attention on those people that won't be attending. Quite a few people will be discharged from hospital and will be then taking some form of medication to make sure that they are on the road to recovery. And SMS is great for reminding those people. So you can remind them to take their medication, but also as a doctor's surgery, you can let that patient know when that prescription is ready to come in and collect. Thinking more about post-operative care, generally, medication is only one part of the recovery process. There may be a need to remind those service users that they may need to exercise in a specific way to help recover from their operation. And the use of text is great, to provide support, but also to give them that knowledge that they need to know in terms of how they should be exercising, what they should do if something goes wrong. Again, it's just extending that hand that they had within the hospital and ensuring that they feel that they're being looked after in their post-operative care. When people leave the hospital after any type of interaction, the hospital always likes to send a friends and family test. However, they generally do it on a paper-based system inside the hospital on the reception desk. All that information then needs to be rekeyed and then entered into some sort of system. We would say, why not just send that friends and family test via SMS? Have the patient complete it online. There's no need for additional resource from the hospital to capture that detail, and all the available reporting is there. It makes sense, it's simple, and it's the most cost-effective way of capturing that level of data. Other ways that SMS has been seen as a main game changer in the last 12 months is consumer choice in the way that they receive their appointment letters. If we think back to Derek, Maybe he's had a letter. Maybe he can't remember where he's put it. It's been filed. The chances of him finding it again are quite remote. Maybe, had he been sent that letter via SMS, he will have been able to open that letter, save it onto his mobile device, and then as and when his time comes to go into hospital, he could quite easily open up that letter, have a read, work out what he needs to do, what he needs to take to make sure that his stay is comfortable. Now, some trusts will also preempt that visit with a further text that allows them to capture all of that pre-operative healthcare check that you have when going in for an operation. It will be your height, your weight, what medication you're taking, what your doctor, who your doctor is, what's been prescribed, what exercise regimes you're on, all that level of detail that the clinical nurse will need to capture on your arrival. Why not turn that data capture into a data checklist? Have the patient complete it before they come in, and maybe save 10 minutes of nursing time processing that service user. This frees up thousands of hours, allows those nurses to go and deal with the more vulnerable people, or to give care where it's needed in a more positive and proactive way. We spoke before about what do these text messages look like. Well, let's just have a look now. On the left of the screen, we'll see that Diane has an appointment with her doctor, and the doctor has given her two choices, either to reply with a yes or to reschedule by using the link. And there we can see the link from Wells Surgery. However, because Diane wants the appointment and can make it, then she has responded with a yes, and the system has auto-generated a response that says, thank you, your confirmation has been received. But not only that, is that the TextLocal system will then take that same trigger, input it into the doctor's patient system, and record that Diane is attending. That's all great, and at no point has anybody needed to become involved in that interaction. Diane is happy, she's achieved her appointment, and the doctor's surgery is happy because they have a confirmed attendee. On the right-hand side, we spoke about the use of the friends and family test. And there is an example of one that's used in a number of trusts. It's very straightforward. You choose one of the boxes that say, would you recommend the service and the practice? And then there's a comments box, which is just out of sight. However, should you scroll down, it enables you to complete and send on. So that is how a service user will see. Also in the center, there's some other ways in which text messaging can be done. Some of them we've already covered, and some of them are there for your benefit. And so I suppose we then come to the questions. So I've had a question come in whilst we have been having the webinar. However, I will just leave it for you to raise your hand, ask a few more questions, and let's see how we go from there. So the first question I've been asked is, what does the platform look like? Well, the platform that you would be generating these messages on, I haven't shown you today, and only for the simple reason that what you will also find on YouTube are many other how-to videos from TextLocal. If it's your first time using this type of service, I would suggest that you go and look at understanding the basics. And I would say thank you for Andy for that question. Okay, Jane from IT has asked, how do you do integration? And that is a very good question. In terms of integration, we have what are called APIs, and those are the connecting links that allow our system to connect to the hospital systems. And any IT person will be able to look at those and work out and do a copy and paste from our pre-created code and then drop them into their system to be able to provide that interaction. Feedback from other IT organizations say that this is quick and easy. It's less of a project and more of a task for somebody to do. It's not onerous and should be done in days rather than done in weeks. Okay, we have Charlotte asking a question about help and advice. Okay, and guessing from what you've written that you are thinking more about how to get the most and the best sorts of messages. Absolutely. Whenever you send a message, you should always look to have a solid call to action. Don't leave the service user wondering. Make sure that the outcome of the text is clear, either for them to call you, for them to text you, or for them to click on a link and maybe continue to self-serve. All these sorts of things have probably been done before by somebody else, so I would suggest that you give TextLocal a call and ask for some help and guidance. We have lots of knowledge of the health market, and anybody that you speak to will be able to give you some guidance in how other organizations use the system. I've had the obligatory how much does it cost question, and I would say thank you to Rachel for asking that question. So how much does it cost? Texts from TextLocal start at around 4.9 pence if you are looking to buy small amounts. However, the average health trust will probably use in the region of $1 million to $2 million, and at that rate they can start to see the price drop. And in terms of actual pricing, then we have a tariff that we are happy to share. Again, please call TextLocal and share the volumes that you are looking to do, and we will be able to give you some cost-effective pricing. So I'll just wait for another second, see whether there's any more questions. Okay, I'm not seeing any more. And the ones that I have seen are pretty much variations on what I've already talked about. So I do believe that we should have answered everything that was asked generically. If anybody has anything specific, and I'm sure that you will have, what I would suggest is that you use the contact details on the next page, get in touch with us, and we'd be really pleased to help you out. And we look forward to being your SMS provider in your health organization. Thank you.